If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't eat almost anything.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
It's more affordable.
Very affordable. It's well worth it.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
With these, I can eat everything.
Now I can smile and show the world.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It gave me the confidence to have my smile back.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
It was life-changing.
I don't know what else to say except it was almost a miracle.
It's just so much better.
I'm happy. I'm very happy.
It literally changed my life.
My dental implant has changed my life.
I'm excited to be me again.
I feel like me again.
It'll be the best, smartest move you ever made.
I love it.
It's incredible. It is. It's absolutely incredible.
Welcome to Innovations in Health. I'm John DeSciullo, and we are going to talk about the mini dental implant procedure. It can change your life, where you can be you again, with my special guest, Dr. Josh Dolin from Morgantown Dental Group. They're at 142 High Street in Morgantown, West Virginia. Dr. Dolin, welcome to the show.
Thank you, John.
And we're going to talk about the mini dental implant procedure because this is a revolutionary technique. The mini dental implants, folks, are 5 times less invasive, they're less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And Dr. Dolin, you have some examples, particularly with dentures, a lower denture. Explain how the mini dental implant stabilizes that lower denture.
Yeah, John, so a lot of patients come to see me because they have a lower denture that they just can't keep in. It floats around, it moves, they have to wear the goop to keep it in place. They come to see me. These mini dental implants will actually provide anchors to hook to hold the denture in place. So the patient comes into the office, we place these mini dental implants, which are just essentially threaded titanium posts that just anchor into the bone, and it gives you a leverage point to hold the denture. The denture has a nice little metal housing with a little rubber O-ring that will actually snap onto the implant and secure it in place. So a denture that once kind of floated and moved around now is going to be nice and tight and secure in place, and the patient can again enjoy and chew their food.
So what Dr. Dolin is talking about is that titanium post is going to hold that lower denture in place, and that titanium post, the bone grows around it. But Dr. Dolin, if someone has an upper denture, the taste buds are back because now people can bite into the steaks that they love, enjoy all the foods that we love here in West Virginia. Show us why.
Yeah, absolutely, John. So, you know, a lot of patients, they come to see me because they have an upper denture that just won't stay in place. They maybe have a bad gag reflex. They feel like it doesn't stay in without the goop, so they come in and we stabilize the upper denture the same as we do with the lower, with the implants that anchor into the bone. The denture will have a nice little housing with a little rubber O-ring that snaps onto the implants. You can go out in public, you can go to the restaurant, you can have your denture secure in place without having to worry about it falling out. And also one of the nice things is you can cut the acrylic out of the roof of the mouth, so once again you can taste your food.
Yeah, that's very important to note that the upper part of the mouth is where a lot of that taste sensation comes from, and of course the stability, so you can bite into that steak without the fear that the denture is going to fall out.
Yeah, my dental assistant actually brought her mom in about 6 years ago to do upper and lower implants to secure her denture. And she was amazed at the simplicity. She said it was one of the best decisions she'd ever made. But one of the things that I remember most about that was she said, wow, I can taste my food again. 6 years later, she's just loving life and enjoy the foods that she hadn't enjoyed for years.
So you've been doing implants for quite a few years.
Yeah, going back about 10 years, we started doing this because I hated seeing patients that just could not wear their dentures, that had missing teeth, that needed options. Patients hated having to go here and there to surgeons and back and forth and the time involved. And I'm like, you know, I got to do something. And I saw an advertisement from Dr. Todd Shacken that he did these implants, and it just resonated with me. So I made the trip up to Buffalo, New York, and took a course, and ever since then I've been placing the implants.
So you brought all of that technology from Buffalo, and Dr. Todd Shacken brought it right back down here to West Virginia, not that far away. And what's nice is that you continue to go and get training so that the latest techniques you can learn and bring back to all of our patients here.
Yeah, absolutely. Dr. Todd Shacken is an expert in the field, and I've been using him as a mentor for over 10 years, and we've made many trips to Buffalo, New York to advance in the technology and to always be at the cutting edge of what we need to be to provide the most quality care to our patients.
Yeah. So we just talked about the lower denture, and so folks, that denture where it's swimming around on the base of the gum, and the goop, Dr. Dolin mentioned the goop is gone. And all of that adhesive, sometimes people swallow it. I can't even imagine how that must taste, but people just accept it. Why do people accept this, Dr. Dolin, when they know that they can get the mini dental implant?
Honestly, John, people think there's just no other option sometime. And two, some people just have the fear of the procedure. They've gotten on YouTube or Google and they've watched implant procedures that are much more invasive and involved, and it's just that fear of the procedure, the fear of embarrassment, the not knowing that there's a very simple solution. I have patients that come in and literally in 24 hours, John, we have placed implants and stabilized their denture on the implants.
Because this is an in-office procedure.
Yeah, absolutely. So these patients can come in with an ill-fitting denture, and 24 hours later, they can have that denture secured to the implants and be enjoying the foods that they haven't enjoyed in years. And it's just amazing at how effective it can be for our clients.
I had a lot of difficulty in eating.
I couldn't eat almost anything.
But with these, I can eat everything.
It was done, over, done. Go home and eat.
I can eat steak, I can eat sandwiches.
From the moment I left here, minimal discomfort, even hours later, and I was able to pretty much eat whatever I wanted.
I had dinner 45 minutes later.
I can chew a steak. I could not do that before.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
It's made a tremendous difference.
Best thing I ever did.
I'm very, very pleased that I have them now.
I love it. It's life-changing.
So folks, if you're out there watching and you're watching in Morgantown, if you're in Pennsylvania, you can visit Dr. Josh Dolin at the Morgantown Dental Group. They're at 142 High Street, right in downtown Morgantown. You can't miss them. The phone number to call is 304-202-6559. And if you want to find out more online too, minidentalimplantswv.com. WV, of course, for West Virginia. So we just heard about all of the great opportunities now that the dentures can be advanced with the mini dental implant technique, but there's a more advanced way, as if God gave us our baby teeth, God gave us our adult teeth, and now Dr. Josh Dolin and Morgantown Dental Group, you're going to give us our third set of teeth. Show us why.
So patients come in and maybe they say, well, I like the opportunity to have a denture that's attached to implants, but really I would like to have something that I don't have to worry about, less hassle, less fuss. I don't have to take it in and out. I don't have to take it out and clean it, put it back in. I want something that can be fixed and secure and as close to my natural teeth as possible. So they come to see me and we can utilize the mini implants much in the same way we do for dentures, but rather than a denture, we can actually make a full porcelain, more mimicking of natural teeth, a full porcelain bridge that will actually adhere to the implants and be fixed and secure in place. This is something that the patient leaves in 24/7. They brush and they floss. They come in for their regular dental visits. Minimal effort, minimal hassle. This is kind of an upgrade from a standard denture.
And that's a zirconia product.
Yes.
And that zirconia and the mini dental implant is really designed to take the licking and keep on ticking, because teeth are used constantly for chewing properly and certainly looking good as well. So Dr. Dolin, I know that there was a patient you told me about who decided they had dentures, but when they saw how the advanced mini dental implant could really help them, they decided to take that.
Yeah, originally, John, when they came in, we had discussed the denture. And this was actually a case almost brought me to tears. When I gave the lady the treatment plan, she started crying. And I thought I did something wrong. But she was like, no, this is amazing. Like, I can actually afford this. Like, I think my husband and I can make this work. I've wanted this for so many years, she said. I've just had the denture and I just hate the goop and it wears off and I'm dealing with the public and it's just, I'm so excited. So then she calls back and she's like, Dr. Dolin, what do I need to do to upgrade to the fixed restoration? And we talk about it and she's like, you know what, I'm going to do that. And we see that all the time, just the sheer excitement of, wow, I've been suffering for years with this option that I'm not happy with, and now there is something that I can do that's affordable, that will make me feel whole and confident again.
And that's very important to note, because the mini dental implant, whether it's a denture or the more advanced technique that we just saw with that full look, offers people the confidence level that they may have been suffering from not having for many, many years, just as a result of maintaining the acceptance of having that denture or teeth that need to come out and that mini dental implant needs to go in.
Yeah, absolutely. When you have natural teeth, you take for granted what it's like to be able to go in public and not feel ashamed and embarrassed. And there's so many people that don't want to smile fully and don't want to go in public just because of the fact that they can't feel confident with their teeth, and we can give that back to those people.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again.
How could you go wrong?
I just can't say enough about how I feel.
It's one of the best things I've ever done in my lifetime. I mean it sincerely.
This is something that is so incredible.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
In addition to what you're seeing now, folks, if you have a single tooth, and it doesn't matter what your age, say you've been in a sports injury or a car accident or some issue, or you have an issue with your tooth, because you have an example of how a single tooth could be changed with the mini dental implant.
Just the other day, we had a lady that was scheduled for a new patient consultation, and her chart note said, wants the front tooth replaced ASAP. So I called her on the phone and I said, ma'am, let's go over a couple things on the phone, and if everything sounds good, maybe we can get you your tooth back tomorrow. And she was like, oh, that would be great. You have no idea how embarrassing it is. I lost this front tooth and I need something because I'm so embarrassed in public. So she comes in the next day, and in a single visit of under 40 minutes, we had her a new front tooth. So essentially it works just like a crown on a natural tooth.
Show us how.
Yeah, you have a single implant that's placed in a location where you're missing a tooth. There's going to be a porcelain crown that's made that's going to match and blend in with your natural teeth. And you simply cement this in place right over top of the implant. The implant essentially is the root for the tooth that holds it in place and allows you to function again.
And we should mention, folks, these are custom made for the patient.
Yes.
So it's shaped and conformed and given that identity so that it is very natural in its look.
When you smile, it looks natural and it feels natural, and no one knows that it's not a real tooth.
And it's not going to fall out.
No.
Yeah. Now, if people might have some problems in their back teeth, and you might be watching and say, well, okay, the mini dental implant looks nice, but I have teeth in the back and I'm not going to worry about it. But they should worry about it, because not only does the face kind of get sucked in if the teeth aren't there, you don't eat properly if you don't have back teeth, and the mini dental implant can help.
What a lot of people don't realize is that all your teeth function in harmony. And the more teeth that you have that touch, the more force that you take off of each individual tooth. And when you lose your posterior teeth, your back support, the teeth that are stronger and meant for chewing, you're forced to chew more on those front teeth, which are not designed to handle that long term. Subsequently, you can deteriorate and wear down your front teeth more rapidly than you would otherwise, because there's no posterior teeth. So it's very critical, not only for being able to chew and to get the nutrients out of your food to have your posterior teeth, but also for the long-term protection of your front teeth.
Show us the example of the side and back teeth, because I think it's important to show the viewer.
Yeah, absolutely. So whether
there.
you're missing a single back tooth, multiple back teeth, we have a solution for everything. So we could place one implant, we can place multiple implants, and for whatever space that you have, we can custom make crowns that will actually cement into place, much like the single tooth, directly over the implants. And as you said, a lot of patients will say, I'm at an age where what does it really matter? And I say, when do you get too old to be able to enjoy your smile? When do you get too old to be able to enjoy your food? When do you get to an age where you don't need nutrients out of the food that you're eating?
Yeah.
That's something that is always going to be relevant.
No matter what your age, the mini dental implant can help. And we talked about a patient that had this procedure done and was going to wait a little bit, but decided they liked it so much, they got it all done.
Yeah, she came in, and it was kind of, she was missing her upper teeth on one side and her lower teeth on the other side. She had back teeth, but they didn't help each other because they were on the wrong side. So she was like, well, let's do the one side, and I'm going to wait a while, and I'll do the other side. But she came in, we did the one side, and she said, wow, that was so easy. Like, I want to go ahead and do the other side. So she's scheduled to do the other side. So we got everything finished for her. And she's just like, man, I can chew again, and I'm loving life. So.
It's so easy.
Yeah,
and that's what you need to know, folks, about the mini dental implant. They're 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, less expensive. And you want to find out more on minidentalimplantswv.com. It's a great website that Dr. Dolin and the Morgantown Dental Group have put together, and some of the testimonials from these patients are right there. These are real people from right here in West Virginia that are talking to you about what that mini dental implant experience was all about. Dr. Dolin, we promised our viewers we'd get to know you a little bit. You grew up here in West Virginia.
Oh yeah, absolutely. Been here my whole life. So I grew up in southern West Virginia, in Boone County, which anybody from West Virginia will know and recognize. Moved to Morgantown when I graduated from high school. And I've been a resident of Morgantown right here at WVU for the past 22 years.
Yeah.
Went to school at WVU, undergrad, dental school, graduated in 2005, and love Morgantown. Never left, and I've been here at Morgantown Dental Group, which is a practice that's been open for over 90 years. We're going on 100 years of existence at Morgantown Dental Group with myself and Dr. Mike Wilson, and soon his son, who's a 3rd generation dentist, Dr. Jason Wilson, will be joining the practice. And our reputation, John, has always been patient first service, quality matters. We treat our patients right. We're not corporate, we're privately owned, and I'm going to do for the patient what I would do for my mom if she were in the chair,
Sure.
or my dad, or what I would do on myself. That's the way we work, and we're there for them until everything is right. You know, patients come in and they have a fear. You know, what if something doesn't work? What if something goes wrong? And we're there. You know, we're in this together. We're partners in this journey to get them back to functioning and feeling confident with their teeth again.
Well, not only with your dental partners, but your employees, your longtime employees. You were telling me the average length of tenure is 25 years. I mean, nobody stays at a job that long, but in this case, this really is family. So when you're coming in, you are experiencing what a family dentistry is all about.
Yeah, I mean, fortunately, we don't really know what it's like to have people leave our practice. Our staff retires. You know, we've had a lot of retirement in the past 5 years, but so that speaks a lot, I think. You know, our practice has been voted best of Morgantown 3 out of the last 4 years, and you know, that speaks a lot of what our patients feel about our practice as well, and the confidence that they have in us.
Well, and one of the reasons why is because you have a lot of technology. You know, I was just reading now about the cone beam, which sounds like something from an outer space movie, but that cone beam technology is something you mentioned earlier about how the single tooth option was made so easy because you were able to take a look in the mouth and really get a sense of what the patient's all about.
Yeah, absolutely. A two-dimensional X-ray, which is a standard X-ray, is only going to give so much information, John. So it's very critical if we're going to be placing implants and doing more advanced techniques that we need more advanced technology. So the cone beam, which takes a 3-dimensional X-ray, gives us the ability to view the bone from all angles and to optimize the location of that implant to assure the highest possible degree of success.
And you work with complex cases too. It's something that, you know, what's nice about your practice is you'll take that patient and work with them, and you'll take on that challenge.
Yeah, we do much more than just implants. We're a general dentistry practice. We do everything from fillings to extractions, crowns, root canals, all across the board. So a lot of patients that come in with missing teeth have more complex situations. You know, maybe they feel frustrated and they don't know what the answer is. So our job is to evaluate each patient as an individual, evaluate their individual situation, to sit down and educate the patient of here are your options, here's what you can do, and then hopefully by the time that patient leaves the office, they'll have an informed opinion about what they want to do and how they want to move forward with their dental treatment.
Well, and you're up for the challenges. You know, I know you like CrossFit, you're an athlete, you jump right in there, and so if you're up for that challenge, you're up for any kind of challenge, and you have young children.
Yes.
What I think is nice is that you work with the patient, because when you come in for the consultation, at some point, somebody's going to ask, how much does this cost? Mm-hmm. And there's certainly a cost to it. And a lot of us pay for our cars monthly, they pay for major appliance monthly, and you're able to make the mini dental implant affordable for someone who's out there?
Yeah, absolutely. I mean, cost is always an issue for anyone, right? So that's always something that needs to be discussed. We do offer financing through a company called Care Credit. We understand that not everyone can come up with the money up front. People need to make monthly payments. So we offer an ability to do that. It's a very simple process. It's a simple application. We can walk you through it right in the office in 5 minutes. You can fill out the application at home. And through this, you can get anywhere from 2 years interest-free financing up to 5 years financing at a low interest rate. And our company will take on the fee that we have to pay them to give that ability to you to make the payments to get your life back.
Yeah.
So,
and this is a way for people to really make it affordable. You are working with those patients one-on-one, and when you have that consultation, I'm sure this is what you talk about in addition to what their situation is all about.
yeah, that's very important. I mean, we're going to go over everything in the consultation that you need to know to get the procedure done. That involves the time frame involved, the procedure, the technique, the choices, the financing, the cost, so that when you walk out of there, we've covered all the bases and made it simple for you to make a decision.
Mini dental implant, 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, not that we don't want to go and see the team at Morgantown Dental Group, and less expensive, and you make it affordable. And that's what's very important, because here in West Virginia, we know this is a made in America product. These teeth, these zirconia products, are made right here in America. And whether you're in Uniontown, PA, if you're at the university, and this community has such a great medical community as well, all of these people are welcome to come to your practice. So if you haven't been to the dentist in a while, you welcome them.
That's what we're there for. We're there for the community, and we're there to help. So whatever we can do, whether it just be a single tooth, or you're missing all your teeth, or you're at a transition phase where you know that it's time to transition from your natural teeth that are no longer healthy to something else, we can give you the options and find the most comfortable, convenient way to get you through that major transition that's scary.
And you help people in the community. I know that you work with a group called Health Right.
Yes, absolutely. There's a group, Health Right, that screens low-income patients, and we assist with treatment on people of that nature. And you know, we like to give back to the community. I mean, Morgantown is our home. That's what we're about. We're proud of the community that we're in, and we want to be able to give back to the community.
Well, you do, and it's terrific. And by the way, the phone number, it's on the screen, 304-202-6559. Finish watching our program, write that number down, because then right after the show, you want to pick up the phone and make a call, and Dr. Dolin and his team will talk to you. I think at this point, it's time to show our viewers again. If you've just joined us and you're wondering what we're talking about, it's the mini dental implant technique. If you've been watching for the full half hour, now it's really going to make sense as to what we're all about. Because if you have a lower denture and it's floating on the gum, the goop is gone, the titanium post is going to stabilize that denture. Show us why on the lower example.
Yeah, absolutely. Let's just review this again. So the lower dentures are floating around. We put the mini implants in place, which are anchored solid in the bone. It gives you something to hang on to that denture. So the denture can actually be inserted through just a little housing, a little O-ring that's going to snap right onto those implants. And in many cases, if you have an existing denture, this can be done in the office, and within 24 hours or maybe even that same day, you can have your teeth inserted back on to those implants to give you a better quality of life.
Listen to that snap, it secures right in place. Imagine, folks, having that confidence again. Now, the upper is very important because your sense of taste comes back with the upper in the mini dental implant procedure.
Yeah, absolutely. So the main complaint of an upper denture is that maybe a person has a gag reflex, maybe it won't stay in place, or maybe they just can't taste their food as effectively anymore. These mini implants can give you the ability to cut all of that extra acrylic off of the denture, cut it back off of the roof of your mouth so that it takes away the gag reflex, cut everything out of the palate of the denture so that you can feel your food in your mouth and you can taste your food and enjoy it more fully. And most importantly, no longer have to use a dental adhesive that only lasts for a little while and then wears away, and then you're worried about it falling out in public. Now that denture is going to be secure on those implants, so that you can chew your food and taste your food and enjoy life again.
Yeah, not going to fall out, not going to fall out at all. All right, so if you have the lower or the upper denture, that's one thing, but as Dr. Dolin told us about, a few patients have upgraded because God gave us our baby teeth, our adult teeth, and now this third set of teeth looks terrific.
Yeah, this is the most cosmetic option, but also the most functional and the easiest to maintain and care for, because this is going to be an option that you do not remove. This is something that's going to be more like your natural teeth. It's fixed in place. It's not taken in and out. It's actually a porcelain material that is very hard, much more like your natural teeth.
Yeah.
It's not a plastic. It's much more durable and wear resistant. And this is actually going to adhere to the implants and be something that you keep in on a regular basis. So no more cleaning those dentures at night.
Yeah, and we talk about cleaning. How do you maintain and care for a mini dental implant?
Yeah, absolutely. So home care is much the same as a regular tooth. You know, you're going to use your power toothbrush, which we highly recommend. You're going to floss around, but also water picks are very advantageous of cleaning and flushing around. When you have a full roundhouse bridge that is inserted like this, you want to take that water pick on a daily basis and flush around the gums to keep everything healthy, because just like with natural teeth, implants do need to be cared for.
Sure.
And the more meticulous you are with your home care and your hygiene, the more you're protecting and ensuring that investment that you've made into your better quality of life.
And coming in to see you and your team for
Yeah,
checkups
absolutely.
every now and then.
Yes, it's always, whether you have your natural teeth or no teeth or some of your teeth, catching things early on is always the easiest preventative measure to make sure that your teeth are healthy and that we fix problems before they become big problems.
And
So.
you know, if you think about dentures and you say, well, that's for senior citizens, it is, and that's great. But the mini dental implant can help you at any age. So say you have a single tooth. Let's take a look, doctor, at this option, because this will help people not only look better, but be more confident.
Yeah, whether you've had some traumatic accident in your past, some kind of an injury where you've lost a tooth, let's just say you have a single missing tooth in the anterior. What worse area to have a missing tooth? You don't want a little flipper that's a little plastic partial that you put in and out on a daily basis. You'd love to have something that's less hassle.
Sure.
So the single implant can go in place. A single porcelain cosmetic crown can be made that blends right in and matches your natural teeth. It's simply cemented right over top of the mini implant. It's like having a natural tooth back.
And that can happen in the office in one day, done.
Absolutely.
Yeah. And teeth that are in the back, if you're watching and you say, I have some teeth and nobody sees them, out of sight, out of mind. No, no, no. Very important, not only for your look, but also for your health.
Yeah, much the same as the front teeth. So whether you're missing a single tooth, multiple teeth, teeth in different areas, everything can be restored with a mini implant that anchors into the bone, gives you something nice and secure, just like having the root of your natural tooth back. A custom restoration can be made to fit whatever space you have, and these are simply inserted, cemented right over top of the implants, adherent to the implants, much like a crown would be to a natural tooth. Now you can function, chew, enjoy your food again, help to support and protect those front teeth by being able to chew the food in the back, which is where you should be able to function.
Get all the
and chew.
nutrients out of there. What inspired you to be a dentist, Dr. Dolin?
I wanted to help people, and I always liked working with my hands. I liked painting and drawing and being artistic, and dentistry is my art. Dentistry on a much smaller scale than most people work is my way to be an artist and to design people's smiles and to give them a functional set of teeth back to chew with. So.
And now you're giving many, many patients in Morgantown and in other areas that are watching, you're giving them their life back.
Yeah, absolutely, and that's the most rewarding thing.
Yeah.
There's nothing more rewarding to me than seeing a patient who is thrilled to have their teeth back and to feel confident again. That's the best thing for me. It makes it all worthwhile when you see that smile.
Well, continued success at your practice at Morgantown Dental Group, and the practice has been around a long time. We wish you success. You'll be there a long time too, I bet.
Yeah, got a long ways to go.
Yep, as your family all grows up here in Morgantown, West Virginia. You are an innovator in health, and we appreciate you being on our show.
Yeah.
We thank you for watching, and good luck to you. And by the way, the phone number, in case you forgot, 304-202-6559. Dr. Josh Dolin at 142 High Street in Morgantown, West Virginia. Thanks, Dr. Dolin, for joining us. Thank you for watching.